Do you ever wonder why your heart feels heavy, or why it seems to beat erratically at times? Heart valve problems are more common than you might think, and they can turn the rhythm of your life into a confusing and distressing symphony. It's time to dive deep into the world of heart valve replacement surgery, a crucial procedure that can restore harmony to your heart and your life. Understanding heart valves. Imagine your heart as a busy highway where cars, your blood, are constantly flowing to their destinations. Heart valves act as traffic lights, controlling the flow of blood and ensuring it moves in the right direction. There are four main valves in your heart: the aortic valve, mitral valve, pulmonary valve, and tricuspid valve. When these valves function properly, they allow blood to flow smoothly, but when they malfunction, it's like having a broken traffic light. Chaos ensues. When the valves are damaged due to conditions like stenosis, where the valve narrows, or regurgitation, where the valve leaks, your heart struggles to pump blood efficiently. This can lead to serious symptoms such as fatigue, shortness of breath, and even heart failure. For many people, heart valve replacement surgery becomes a necessary step to reclaim their health. Why replacement is necessary? So, when do we need to consider replacing a heart valve? If your heart valves are too damaged to repair, a replacement is often the best option. The aortic and mitral valves are the most commonly replaced, but in some cases, you may need a replacement for all four valves. For instance, imagine a valve that has been worn down over time, like a door hinge that has rusted and can no longer open and close properly. If left untreated, this can lead to increased strain on the heart, which can be fatal. Types of valves used in replacement surgery. When surgeons decide to replace a valve, they have several options at their disposal. The most common types of valves used are mechanical valves, made from durable materials. These valves can last a lifetime but may require lifelong blood thinning medication. Biological valves, sourced from animal tissues, like pig or cow valves, or human donors. These valves are more natural but may need to be replaced after 10-20 years. Allografts, these are harvested from human donors, providing a solution that reduces the risk of rejection. The Ross procedure. In this unique operation, the damaged aortic valve is replaced with the pulmonary valve from the same patient, and the pulmonary valve is then replaced with a donor valve. The surgical process. When it comes to heart valve replacement, the most common approach is open heart surgery. Think of this as an intricate dance, where surgeons carefully navigate to replace the damaged valve. During the operation, the heart is temporarily stopped, and a heart-lung machine takes over its function. The surgical team works diligently, ensuring that every step is precise. However, thanks to advancements in medicine, there's also the option of transcatheter aortic valve implantation, TAVI. This less invasive procedure is like a guided missile, delivering a new valve through a catheter without the need to open the chest. Patients often experience shorter hospital stays and quicker recovery times with this method. What to expect before surgery? Preparation is key. Before your surgery, your medical team will walk you through every step, explaining what to expect and addressing any concerns you may have. Typically, you'll spend the night before the operation in the hospital for blood tests and monitoring. On the day of the surgery, expect to be prepped for the procedure. Hospital staff will make sure you are comfortable, administer a sedative, and take you to the operating room where you will receive general anesthesia. The recovery journey. Recovery after heart valve surgery is a gradual process. After open heart surgery, you'll wake up in the intensive care unit, ICU, where medical staff will monitor you closely. It can take several days in the hospital and months at home to fully regain your strength. During recovery, it's common to feel weak and fatigued. However, as you begin to resume your daily activities, you'll likely notice improvements in your energy levels. Most patients can return to normal routines within a few weeks, but it's important to avoid high-intensity activities until your doctor gives the green light. Risks and considerations. While most heart valve replacements are successful, it's crucial to understand the risks involved. Potential complications can include infection, bleeding, or the new valve failing. According to research, the risk of dying during a valve replacement procedure is low, but it does exist approximately 1.9% for mitral valve replacements, and 9% within 30 days post-surgery. Additionally, those who receive biological valves have a lower survival rate over time compared to those with mechanical valves. Conclusion: the beat goes on. Ultimately, heart valve replacement surgery is a powerful option for those struggling with heart valve problems. If your heart valves can't be repaired, replacing them could significantly improve your quality of life, reducing symptoms and enhancing your overall health. Remember, the heart is the engine that drives your body. Taking care of it is essential to maintaining your well-being. If you or a loved one experiences symptoms related to heart valve issues, don't hesitate to seek medical advice. The journey may seem daunting, but with the right support and treatment, the heart can beat stronger than ever. So, take charge of your heart health. Understand the options available and arm yourself with knowledge, because when it comes to your heart, it's always better to know more.